Welcome to this edition of Special Segments. I'm your host, Erica Schaefer. Now today we have with us a very special guest, Dr. Tricia Lee, owner and founder of Family Dentistry of Plano. Dr. Lee is a 15-year veteran of dentistry and an expert in all phases of dental practice. She is regarded as an expert in general dentistry, implant dentistry, orthodontics, both adult and children's, sedation dentistry, TMJ, and sleep apnea. She is here to speak today specifically on the topic of fast, affordable dental implants for all. So stay tuned. The information here will change your smile and your life forever. Welcome back. I'm your host, Erica Schaefer, and you are watching Special Segments. Now, I'm very pleased to have with me in studio Dr. Tricia Lee, long recognized as one of the top dentists in North Texas. Now, what many don't know is she is said to be the friendliest and most personal dentist in all of Texas. Well, hello, Dr. Lee. Now, it's great to have you on the show today.
I am glad to be here.
Now, I believe you are the friendliest dentist in Texas.
Thank you.
And I know you love your practice. So what kind of patients do you see?
We have two dental practices. They are general practice in Plano and Richardson, Texas. We provide all aspects of general dentistry for patients from 3 years old to 99 years old.
Wow. So that's a big practice. Two of them. Now, the benefits, who benefits from dental implants?
I have to say that anybody who lose one single tooth to somebody who lose all their teeth, anybody who lost teeth will be benefit from having dental implant. There's a myth that people say that if you can be too old for dental implant, and I just want to clarify that fact. Age doesn't affect the success of dental implant. Actually, dental implant was created and invented for people who lost all their teeth. That is the original reason of why dental implant was invented, and those are for the folks that are in older age. So if anybody who thinks that they are too old for dental implant, it never be.
Or too young, right? It's for any age.
It's actually started at 18 years old, and I hope that unless you are not born with teeth, not a lot of people that actually lost teeth at 18 years old. There's some patients who just genetically don't have some teeth in their mouth, and they can start having implant to replace the teeth at 18 years old.
Oh, wow, that's great. So what are the common problems you see for those who still have dentures?
You know what, I think that they have so many problems. The first problem that I would like to discuss about is that the denture never stay in place. They move all the time, and they rub and hurt the gum. It is just constantly all the time.
Just constantly rubbing on the gum.
Right.
And you're trying to eat food and it just doesn't stay.
It doesn't stay. The second is the confidence of the person who wearing denture. They always have to guard. They always feel like, okay, when my denture is going to fall out of my mouth. They cannot live naturally. It's just because they don't want to laugh too loud or say something that just suddenly lose the denture, and then the denture may just come out from their mouth. The third problem with people wearing denture is that they cannot eat well. They can never chew their food as well as if they still have their real teeth or having their teeth fixed with something like dental implant. You ask most of people who are wearing denture, they cannot eat certain things.
Right.
They cannot eat steak, they cannot eat carrot, they cannot eat lettuce, they cannot eat anything crunchy, nuts or anything like that.
Right. That cuts out a lot of fun food.
Absolutely.
Well, what kind of results can a patient expect with implants?
I would say instant relief. I just compare somebody who having denture for such long time and having teeth that are supported by implant is compared with somebody who have a pair of really tight shoes that they just so uncomfortable, causing so much sore and pain all the time, suddenly slip into a comfortable slipper. It's just an instant relief in the way that they're not going to cause pain anymore.
Right.
They're not going to move around. They're going to stay in one place, look wonderful, and the patient can eat anything they want
And
to.
laugh and
Absolutely.
all those things. Now, what was the point when you knew you really wanted to be a dentist?
I want to share with you a story, what bring me into become a dentist. My family and I planning for me to become a pharmacist. So I went to school and just say, okay, I go to school in order to become a pharmacist. And I met one pharmacist while I'm preparing in order to apply into pharmacy school. What she shared with me and when she talked to me, and she suggests dentistry. She just says, it's kind of similar, Tricia, so how about you look into it? So I follow her suggestion and I start studying in order to apply to dental school, and I got accepted into dental school, and I just go on, I just say, okay, that is something that I'm supposed to do. By the time that I got to third year, it is the year that I start seeing patients. And I find out that this is absolutely my best career. I love to be able to meet with people and be able to help them. And since then, up until this time, 16 years later, I still think that is the best choice for my career.
Oh, that's great. Well, what happens to a person inside when they get a smile makeover?
I have to say that what I see over and over again from all of the patients, from the people who actually having teeth that they don't like, to the people who actually have teeth from changing from their denture, they feel good about themselves. They look good, they are happy, and they are confident. They are confident that life is good and they can do anything they want to do.
That's wonderful. Really, it's freedom.
Absolutely.
More than anything. Well, is there an implant patient that you've had that really stands out in your mind?
I do have a lot of stories, but the person that I would want to share with you today is Bob. Bob came to see us when he was, I say, 65, 66 years old at that time. And he was very unhappy. It's very, very unhappy. We always sit down and have an interview with each of my new patients on the first appointment. I just would like to need to find out that what bring them there, what bring them to come and see us, what their concerns are, what kind of problem that they're facing, and what kind of outcome they're looking forward in order to have. So I sit down with Bob on the first day that we see each other, and he looked like a grumpy old man. He looked like a grumpy old man. He complained that he had denture for 30 years. Till that time, it was a long time. He wear denture for a really long time. The teeth never fit. They move all the time. But he just thought that that was the only way that he can have teeth. There's no other way unless he just have no teeth in his mouth at all. And he complained about his face doesn't look the same as it was before.
Right.
He said, Tricia, there is some reason of why that I don't look like myself. And the third thing that he said that you cannot believe how long it has been since the last time that I eat a piece of steak. And I love steak, and it has been at least 10 years now that I have been not been able to eat steak. We look at him, we evaluate the situation, and something that I find out is actually he has lost so much of bone and so much of the chewing ability from the 30 years of using denture to the point that his lower face actually shrink in. And that is why every time he bite down, his jaw has to move all the way forward in order to have the teeth coming together. That is why he doesn't look like himself. This one-third part of his lower face actually shrink to only half of the size supposed to be. He has no bone on his jaw. It's just like if anybody that you think that have no bone left, we're talking about Bob. He has no bone left on his jaw. So that is why he have gone from dentist to dentist, and people just say to him that there's nothing that they can do in order to help him. We talk about treatment, we talk about the option of what we can improve his situation. I did a new set of teeth for him, and the teeth are clipped into a couple implants. And the treatment is about, I say, it takes us 3 weeks in order to make the new teeth, and then the surgery for 1 day, maybe a couple of weeks later, he'll be able to wear the denture that actually clip into the jawbone. Stay, don't move anywhere, and he looked gorgeous. I just met him last time I say for his 6-month continuing care or something, and one thing that he said to me is that, Tricia, you cannot believe how well I eat steak nowadays.
Oh, that's a great story.
And you know what? That makes me just really happy.
Yeah.
Because I look at him, I just say that I totally remember now on the first day that when we see each other, that you tell me about you not being able to eat steak for this long, and then he just said that you cannot believe now. So any of you who've been thinking of wanting to eat something that you have never been able to, come and see us. Maybe we can help you.
That's a great story. Well, when we come back, we will tell you about how Dr. Lee has perfected painless dentistry. I love that idea. We'll be right back. Welcome back. Dr. Lee, during the break, we had our trivia question, and that was, how many denture wearers are there in the U.S.?
There are around 40 million unhappy denture wearers.
40 million unhappy denture wearers. That's a lot of people.
Absolutely.
Well, tell us about your staff. Your patients just rave about your staff, and they know them all by name.
I love them. We usually ask patients of the reason of why they come to see us and what about us that they love about and everything. And I have to say to you that I have a lot of answers, different reasons and everything, but there's one constant answer that I receive from each and every one of my patients. They love my team. They love my team because they know the ladies who work for me, we have 7 of us in the practice. They are all professional. They know exactly what they're doing. They take very good care of patients. And they are happy at work. And what patients share with me is that, you know what, I know that they love their job. That is why they are happy all the time. And it is a good environment to be in. I feel that I am very lucky in order to have them because I could not have 2 successful practice without my team.
Right. It's all about surrounding yourself with good people.
Absolutely.
Now, is it true that a patient can walk into your office and leave that very same day, just a few hours later, with a whole new set of teeth?
It sounds so good to be true, huh? Yes, but I have to say to you that I lie if I say that if you come into my office for the first day, you meet with me, and you'll be able to get out and having a new set of teeth, that is not possible. What I mean of having a set of teeth on the same day is that we still have to see each other on the first initial exam and visit. I understand about your situation. We talk about what kind of option that you have, and do some preparation on the lab work, preparing the new teeth for you and everything. The day of your surgery, you come in. I have patients who come in either with a set of teeth that they have that are broken down, have infection and everything, or people who haven't had teeth for so long that they wear denture. We can do the surgery and have a set of teeth that are new, good looking, and even fixed on that same day.
Wow,
that is possible.
People struggle for years without great teeth, and then one day they can walk out feeling brand new.
Absolutely.
I love it. We found that you place a very high importance on the personal level of care. Is that your key to success?
Absolutely, Erica. I am a consumer and I am a patient of somebody else also. So everything I do in my practice, I always try to put myself in the shoes of my patient, really think that what they're looking for and what going to make them comfortable.
No, I think that's great because what you said is you're a patient too.
Right.
And so you put yourself in their shoes. It can be scary, but if you give them a great personal touch and your staff makes everybody feel so comfortable, some of these surgeries or procedures aren't that scary anymore.
Absolutely.
It's a positive experience.
I have to say that having a high level of clinical skill is my responsibility to my patient. That is something that they all have to expect, and it is my job that I should show to them. But for them to know that they are cared for, they have a dentist who really, after their best interest, listen to them and be able to find a solution and partner with them in order to solve their dental problem. I think that is important.
Oh, definitely.
And sometimes it is more important than how well you can do the job for them, which I never put that lightly. I always shoot for providing the best dentistry for my patient.
That's great. Well, we noticed that you also don't charge a $300 or a $400 consultation fee like most dentists do. Why is that?
That is a discussion that we just been asked all the time. And you know what? There's somebody who hear that we actually meet with patients for the first time and not charging them anything. They question. They say, "Are you real? Are you serious? You may just pretend like you're not charging me, and by the time I get to the office, you're going to start charging for this and that, and by the time I get out of the office, I have to pay like $300 anyway." I want you to know that it's absolutely free, and it is not a consultation that some of people are doing by having one of their team members meet with a new patient and show them a video and say, "Oh, by the way, if you want to meet the doctor, you have to put down $300 to reserve the spot." My initial visit with a patient is a real comprehensive examination. I meet with them first in order to understand the situation. I think it is so important. I cannot help people if I don't understand where they're coming from, what their problem, and what holding them back. Because the problem you can see, but what holding them back, if they don't open up and share with you, you cannot see. And you cannot help people if you really don't know what really holding them back, what make them getting into the situation that they are in at this point. We're doing a full set of x-rays and x-rays that are necessary. I share with them the condition of their teeth or their dental condition at that time, and also share with them all the options that they can choose out of what dentistry can do in order to improve the situation. With that, we share with them the investment of how much it's going to cost for each of the options and help them through finding the way in order to finance or make dentistry affordable for them. That's all going to be comprehensive for new patients who come to see me. I just say that, why do I have to charge people when I even don't know whether I can help them or not?
Right.
The first initial consultation to me is a chance of them to get to know me, for my potential patient get to know me and see if whether they like me enough and would like me to take care of them. After the consultation, if they feel like, "Hey, I love you, Trisha, and it seems like you are the person who actually can help me to solve my dental problem," they know that they can be very well taken care of. If they decide that I'm not for them, it's just a good meeting, we shake hands and we part. It is no problem, and there's no string attached or any obligation or anything on the part of the patient.
That's great. Well, if you have dentures or if you have missing teeth, why don't you stay tuned, because you don't want to miss our next segment. Welcome back. Now, Dr. Lee, our trivia question was, how many are really happy with dentures or missing teeth?
I have to say that in my experience, it's very little. It's
very small amount of people.
Very likely less than 5%. And to me, even the smaller percentage of less than 5% of people who really think that they are happy with their denture, I think it's just because they don't know any other better options.
They don't know any other options, so they don't know any better.
Right.
Yeah.
If I actually meet anybody who say that, "Trisha, you know that I'm so happy with my denture, you don't have to do a thing, I just live fine, and I have the ability to put implant and replacing their denture with implant and free of charge to them," after the experience, I know for the fact, I know 100% that they're going to choose the teeth supported by implant over denture, 100%.
Making treatment affordable for all is something that your patients love. So tell me about that.
For everybody who I talk to, if we just start talking about the subject of dental implant, you know, what they're going to come up with as the first question.
How much?
Right?
Yeah.
Everybody thinks that it is too expensive. Yeah. And I have to say to you that as we're asking them furthermore, you think that it is expensive. Do you know how much it is? None of them can answer me. They actually think that it is expensive without really knowing that how much it actually is. I just think that for the benefit of dental implant bring to our life, comparably, I don't think that it is that expensive to all of the benefit that actually it can change our life. I meet with our patient, discuss with them on the option that they can have, and share with them how much the investment going to be for their particular situation. We come up with idea of how we can make those investments fit into their budget by monthly payment or breaking down the treatment into phases. And also, we work with all dental insurance. Most of our patients having dental insurance, so we work with them. That make the treatment affordable for them.
Definitely.
And it is so important. After all of that being being figured out, patient can find out that it is not that expensive in order to be able to change your life.
Change your life, be able to smile and laugh and eat what you want. Yeah.
It is so important. There's no money actually can trade for that. I really don't think that it is totally something much more than money can buy.
Oh, definitely. It's changing your life. It's a life-changing thing to do.
We have a lot of older folks now who are in 60, 70 years old, and you know that they are still very young at this time, still very active. They still go water skiing, they still go golfing, they meet with people for dinner almost every night since they don't have to work anymore, they can stay late out.
Yeah.
They want to enjoy that kind of lifestyle, and as you know that if they, at the age that most of people say that, okay, I don't care so much about my teeth look or whether I eat well or not. Those group of folks don't. They want to look their best because they still have a very active life.
In researching for this interview, we found that dentures can lead to serious health, nutritional, and even social problems. I wasn't aware of that. Do you see this in your practice?
Absolutely. Each patient come to see me with the denture problem, Erica, having different story. But all of the story coming down to they cannot eat very well. There's a lot of food, especially vegetable, that they cannot eat. So it's affecting their health. You know that a lot of bacteria can trap underneath those dentures, that causing some infection of the gum and even going into the body. And about their social life. I have to say to you the story about me spending the first year after dental school with a dentist who working for nursing home. We went to 5 different nursing homes in the Washington area during that time in order to visit on the patient and try to fix denture for them. Most of them have a sad life. They don't want to go anywhere. Most of their teeth are in the cup. They just don't enjoy life at all.
Yeah. And the dentures hurt to put in. When my grandmother was dying, it hurt to put her dentures in. She didn't want to wear them anymore. Yeah, I've experienced that.
If you go to the nursing home and you talk to most of the people living there, they don't want to wear their teeth unless they absolutely have to. They don't use their teeth in order to eat because they cannot eat with the teeth anyway.
Eat. Yeah.
My goal, my wish that I be able to touch those lives. I am able to go to those places that I visit. How many years ago? 16 years ago. At the time that I didn't know any better. I just didn't know whether I can help them in order to give them back the life that they can still enjoy. I am so sure that if they have teeth that fixed, they can go out and eat. They can show themselves with beautiful teeth. They're going to be happier.
Right. No, that's great. That's a great story. And that's really important. That's something people don't realize.
Right.
How hard it is to wear dentures and how limiting it is.
That's one thing about people wearing denture. It's just, they just thought that was it.
Right.
They just did not know.
They didn't know there were other options.
They either say that, okay, I am too old, I don't have any teeth anymore, or it's too expensive. Those are the part that hold them back. They just say that there is no way that I can be free from this situation. I either accept it and live with it because there's no other choice. Now there is choice. There is choice. I just know that most people will find out that this is affordable. This can be done.
You offer a free special report on implants the people at home get without talking to anyone in your office. That's great.
Yes, I wrote that report for people who want to know more information about dental implant, because you know that most of people want to ask questions about the subject, but they just don't know who they're going to ask to, and they just don't want to pick up the phone talking to somebody at the dental office. They feel like I just don't know whether my question is even makes sense or not and everything. So that is why I wrote those reports and put it on patient who just having problem with their denture or missing teeth. Pick up the phone call, toll-free number, 24 hours a day at any time. They just leave their name, their address, and I will send the report to their home. They can read that, know a little bit about the procedure, know a little bit about my practice and myself. And after they read the report, if they still have more questions and they would like to meet us in person, they can just call and make an appointment for themselves.
Wow, that's great. That makes it so easy.
And just like I discussed with you before, the appointment they come in going to be free.
A free consultation.
Absolutely.
Which is a wonderful thing that you give to people. You hold free seminars in the Dallas area, which is great to educate. Now, why is that so important to you?
It is so important in the way that it's just like the people that I just discussed with you, that they just would like to have information, but they don't know who they're going to ask. They just don't know whether they're ready, to come to a dental appointment or not. And also, I have a lot of people who get to know me, go about what I can do for my patient, but they live a little bit far away from my practice. They're not sure whether it's worthwhile for them to drive all the way to Plano in order to meet with us for a dental appointment or not. I come to them. I open seminar in different locations throughout North Dallas and be able to meet with all of the potential patients who have questions about implant. They can meet with me in person. They can listen to my seminar sharing with them of what I can do. They can personally ask any question to me, meet with my team, and I think that it is going to be a really, really easy way for them to get to know us.
That's great. That's really a great service that you offer. Oh, you are the friendliest dentist in the Dallas area. I love it. In Texas, in all of Texas. Well, that has been some powerful information today from Dr. Tricia Lee of Family Dentistry of Plano. If you are not happy with your smile, call Dr. Lee now. She can make your smile perfect, affordably, for all budgets. If you have any questions, feel free to call directly at the number below. I'm Erica Schaefer, and it has been my pleasure to be your host today on Special Segments. Thank you, Dr. Lee.
Thank you, Erica.